Well, the first is that there's an international psychedelic science renaissance taking place within prestigious institutions like UCLA, Johns Hopkins Medical School and so forth, and Australia is not engaged in this research. My second point would be that this research is demonstrating that many of our beliefs regarding psychedelic drugs have over-exaggerated the potential harms associated with these drugs, and that in fact, rather than inducing mental illness, these drugs are increasingly being shown to be effective in the treatment of treatment-resistant depression, treatment-resistant PTSD, also for people in palliative care who are experiencing anxiety and depression, and interestingly, substance use disorders, which we know is a chronic relapsing condition. But the preliminary evidence is certainly showing that by providing people with a psychedelic-assisted moment in which they experience a peak state or a mystical state, as many researchers from the 60s would tell us, this is a really effective way of addressing substance use disorders with a low rate of relapse compared to our current treatments.
So we have a lot of treatment options that aren't being fully examined and utilised. Is that basically the use of psychoactive substances?
Yeah, so I think there's good evidence mounting that these are effective treatments, but further research needs to occur. It really needs to occur in Australia though. Australia is not taking part in this international psychedelic renaissance, and in doing so it means that people in Australia are unable to access these treatments where they are in other countries that are undergoing the clinical trials, which means that Australians continue to suffer, may commit suicide or travel overseas to access these therapies.
Do you think some of that overseas evidence is going to provide Australia with evidence to start researching those things or start utilising those things, or do you think that has to happen here?
I think before the TGA is going to approve any of these as medications, we need to demonstrate that in Australia we have the people and infrastructure to be able to safely and effectively provide these treatments. So to be able to do that, we need to first engage in some clinical research to demonstrate that we have the capacity to do it in a safe and effective manner. Well, I think 5 years is a bit optimistic, but maybe in 10 years we might see these treatments integrated within the ATOD sector with clinicians trained in how to conduct the psychotherapy. There's extensive training that's required before people are able to engage as therapists within these particular psychotherapy modalities, and so ideally that the therapists are trained up within our ATOD sector to be able to provide those therapies, and that our sector is open to the idea of these very innovative but yet novel approaches using substances that have been typically pathologised. And so I would hope that in 5 years' time, when I'm coming to present at a conference, this information is not new to people, and that the idea that psychedelic drugs are harmful, while they certainly do have some harms associated with them, that over-exaggeration that's been perpetuated for over 40 or 50 years has dissipated as a result of myself and other individuals continuing to raise awareness about these drugs and the way in which the harms have been over-exaggerated.
Yeah, you're exactly right. It's been kind of swept under the rug. I've got undergrad and postgrad studies in psychology, and that was the first time I realised that LSD helped find serotonin. I never heard that.
It's not in the textbooks. The first time I came across dimethyltryptamine was in talking to a friend I hadn't caught up with for a while. At the time, I was coordinating the addiction studies program at Curtin University, and didn't I feel like a dill when I've got somebody in the community telling me about a drug that's in none of my textbooks, is a human neurotransmitter, and we don't really know what it does, but it tends to, when taken exogenously, tends to put people into an extremely altered state of consciousness where they experience other realms and different dimensions with entities that communicate with them. This is fascinating stuff, and it's in none of our textbooks.
Why do you think that is? Is that conservatism you're talking about?
Yeah, I think the reason that we don't read about, I think the reason a lot of this information is not included in our textbooks in psychotherapy or psychology or social work or whatever we're studying is not because the research was halted, but because of the way in which the research was halted, which involved the beginning of the war on drugs and the concerns around a social movement at the time and ceasing that social movement. So it's not that the drugs were banned, but it was the socio-political context within which they were banned that has led to them being sort of swept under the carpet, and all this evidence swept under the carpet and not being presented to your average student.
But in tertiary education and tertiary institutions, you kind of see them as sitting almost outside of that. They kind of, where you kind of assume they're areas for that sort of free thought and high functioning, high thinking. Do you think they've obviously been impacted by those systems as well?
Yeah, I think up until recently they absolutely have, but I think change is abreast in Australia, and increasingly within neuroscience courses, within addiction studies courses, students are being exposed to this information. They're being exposed to the myths that have been perpetuated, and in turn some of them are re-educating their parents and their friends and colleagues about the misinformation that's been provided to us for so long.
So it's almost an organic groundswell of people coming out.
And a really good example of that is Students for Sensible Drug Policy. So Students for Sensible Drug Policy is a grassroots movement that's about creating rational policy reform that's based on evidence, that incorporates this sort of information, and they've done a tremendous job, certainly on the East Coast so far. We're seeing a chapter being established at Edith Cowan University, and hopefully we'll see chapters set up in Tasmania as well.